Hello, my name is Harish Kumar, and in this presentation, I will discuss my research project titled Predicting Diabetes Risk Using Machine Learning Technique. This study was completely as part of CST7000 module in the MSc Data Science program at Cardiff Metropolitan University under the supervision of Dr. Priya Sarashini Rajaram. The focus of this research is to examine how machine learning can be used to predict diabetes risk more effective using healthcare related data. Next slide. Diabetes is one of the most significant global health challenge today. It affects millions of people worldwide and not affected by managed earlier. It can lead to serious complications such as cardiovascular disease, kidney failures, nerve damage, and vision problems. This makes early predicting extremely important. From a healthcare perspective, early protection can support timely intervention, lifestyle changes, and preventive treatment, which may reduce both personal and healthcare burdens. In recent years, healthcare can increasingly move toward data-given approaches where patients' data is analysis to identify pattern and support decision making. Machine learning is especially useful in this area because it identifies complex relationships in medical data that may not be obvious through traditional methods. Next slide. The main research problem is that diabetes is often diagnosed at a late stage when symptoms and complications have already become more severe. In many cases, individuals may not be aware that they are at risk, which limited opportunities for earlier preventions. Traditional clinic approaches are valuable, but they can have limitation. They may depend heavily on manual interpretations and may not be effective for predicting future risk across large group of patients. Because of this, there is a growing need of predictive models that are faster, most constant, and capable for analysis multiple risk factors at the same time. Next slide. The overall aim of the research was to develop and evaluate machine learning models for predicting diabetes risk using healthcare data. To achieve that aim, I set several objects. First, I prepared and processed the data set by handling for formatting issue and checking for missing, invalid or duplicate values. Second, I carried out exploratory and data analysis to understand the distribution of variables and relationships within the data. Third, I developed three classification models: logistics, uh, regression, random forest, and support vector machine. After that, I evaluate their performance using standard classification metrics such as accuracy, presence, recall, and F1 score. Finally, aim to approve the model performance through uh, turning and validation techniques. Next slide. The study was guided by four main research questions. The first question was which machine learning model performs best for database prediction. This is important because different algorithms may have differently depending on the structure of the data. The second question was how accurately can diabetes risk be predicting using the selected data set. The focuses on the reliable of the prediction result. The third question was which input variables are most influential in prediction. In other words, I wanted to understand which health related failures contribute most strongly to identifying database risk. Finally, the fourth question was can machine learning uh, meaningfully support earlier diagnosis and healthcare decision makings. Next slide. For the study, I used to secondary publicity available analysis healthcare data. This means the data did not contain any personal identifiers and was suitable for research use. The dataset include key health related variables such as programmasis, glucose, blood pressure, skin thickness, insulin, BMI dataset, predictor function, and age. The Target variable was outcome was zero represents no diabetes and I represent diabetes. In terms of methodology, the study following step-by-step machine learning followed. It started with data processing where the data set clean and check is continuously. Then I perform exploratory data analysis to understand failure distribution and patterns. After that, I moved to model development where I trained multiple machine learning classifiers. Finally, I carried out evaluation and optimization, comparing the model and examining which the performed best. Next slide. At this age, I prepared the data set is analysis and model development. The data set contains 768 observation and 9 variables, including 8 failures and 1 target variables, which made it suitable for binary classification problems. Uh, Two initially inspection showed that the dataset quality was general good. There were no missing valuable identification in the original dataset, and no duplicate recording uh, were found during pre-processing. However, I did identify a formatting issue in the column structure. Next slide. The results showed that random forest achievement the best overall performance. It reached an accuracy of 87% and F1 score of 0.81 and ROCAUS score of 0.95. This indicates that it was the most effective model of distributing between diabetes and non-diabetes cases in the dataset. The support vector machine also performed well, while the accuracy of 83.8% and F1 score of 0.77 and an ROCAUS of 0.89. This suggests that it proved strong classification result, although it was extremely less accurate and the random forests. In comparison, the logistic registration shows the lowest prediction performance and accuracy 70.8%. Next slide. The key finding in the study of the random forest was the best performing models among the three test algorithms. It achieved the highest across the main evaluation metrics and showed the strong ability of correct classification both diabetes and non-diabetes cases. The support vector machine also gave strong result and shows a better balance between precision and recall than logistic regression. On the other hand, regression reduction of the weakest performance, particular in the terms of recall. This suggests in linear models may be less effective when the underlying and relationships and more complex. Next slide. This study is a significant both particular academically from a particular perspective. It demonstrates that machine learning support the earlier identification of individual at high risk of diabetes. This could improve preventive care, enable care clinic innovations, and reduce the burden associated and delayed diagnosis. The study also contribute to health analysis by showing the patient related variables can used for risk reduction. It highlights the role of the data science and addressing the whole health challenges. Next slide. Although the study produced useful findings, there are several limitations that should be acknowledged. First, the study of the second data set, meaning of the data already being collected and could not be controlled by the researchers. This limits the availability of verify now. Every value was originally recorded. Second, the dataset size relatively small with only 768 observations. This may affect the general ability of this result. Third, the dataset contain a limited number of features in real world healthcare. Diabetes risk can also be influenced by additionally clinic behavior and lifestyle factors that were not included here. Next slide. Uh, to conclude, this study evaluated the three machine learning techniques for dataset risk prediction. logistic regression, random forest, and support vector machine. The result clearly showed that the random forest reduced of strong overall performance, achieving the highest accuracy F1 score and ROC among the tested models. The finding confirmed that machine learning is a valuable tool for the early diabetes risk assessment. Predictive models can support more effective data-driven healthcare decision making and may contribute to earlier intervention for at-risk individual. However, the study also shows the model section data quality and healthcare content remain critical important when interpreting and applying these results. Thank you for listening.